Thank you so much for that introduction. I'm going to start it off. And we are going to talk about how pornography is harming kids, but really what we are doing in our partnership to help. So we know from the amazing earlier presentations that porn has become the de facto sex education for young people today. With its ease of access, it takes 5 seconds or less to get to any number of free porn sites with 60 or more categories to choose from once you're there. With its affordability, offering free porn, we have often said is like providing cigarettes outside of a middle school. It brings kids in, defines who they are before they get a chance to define who they really think they are. And this freemium business model that the porn industry has really markets to kids by not only exploiting their keystroke errors, but as we had mentioned, using porn-based cartoon characters. And this is just really so easy to see. There is also a parental naivete gap, and we may argue that it's an adult naivete gap that we just talked about, and that many adults are just naive about the depth, the breadth, and the harms of this $100 billion porn industry. Studies are showing that half as many parents think their 14 and 18-year-olds had seen porn as had in fact watched it. And depending on the sex act, parents are underestimating what their kids are seeing by as much as 10 times. So again, like Dr. Hilton mentioned, as the tobacco industry has argued for decades that there's no proven connection between smoking and lung cancer, so too has the porn industry denied the existence of more than 40 years of empirical research on the impact of its products, especially in exposing the behavioral, mental, and psychological effects on our young people today. Researchers have also documented a multitude of associated risks, and these are just a few to name: increased risky sex and casual sex, the preference for pornography over sex with an actual partner. And we're seeing this increasingly with AI-generated porn and porn robots. Also, the increased sexual objectification of young girls and women, rape myth acceptance, sexual coercion, and aggression. As we've discussed previously as well, the limited capacity for empathy and body image questions, self-esteem, and increased anxiety and depression. Now, these are the groups of young people who are also more likely to experience physical and sexual abuse. They're bringing them to the center of your work. So these are the groups that are especially at risk of not only pornography, but physical and sexual abuse. So we're talking about our rainbow youth, our youth on the spectrum, those in foster care, those who are differently abled, also those youth with a history of sexual abuse and a cluster of the adverse childhood experiences. So these are the kids that you're seeing in your work, usually if you're working with Child Advocacy Centers. And again, to reiterate, studies are documenting this causal relationship instead of the often reported correlational relationship that we see a lot in the social sciences between porn exposure and problematic sexual behavior in boys. So boys are intentionally seeking out porn. Those who intentionally seek out porn are 6 times more likely to self-report sexually aggressive behavior. They're more likely to want to try out what they've seen, and they're also more likely to sexually harass. There are 3.3 times more likely to engage in this problematic sexual behavior. We're also receiving anecdotal evidence from frontline child protection experts who you've just heard from in the panel regarding child-to-child sexual abuse, where they're reporting that the age of the perpetrator is getting younger. So it used to be 14 to 18 years old, and now, if we can call them perpetrators, they're 11 to 15. The age of the victim is also getting younger, from 8 to 11 now to 4 to 8 years of age. And they're reporting to us these porn-themed acts that Heidi mentioned just recently: strangulation, biting, anal penetration, hair pulling, and name calling. Now we're going to pass it on over to Heidi for her review, the findings, and the need for our current collaboration. Take it away, Heidi.
Right. So I was tasked with doing a lit review, trying to figure out kind of, are there best practices that exist for professionals around assessing kids for pornography? Sort of what already exists that we could implement. And, a few weeks into this, I reached out to Mandy and Gail and said, I can't find anything. Am I doing this lit review incorrectly? They're like, no, nothing exists. We just, needed to confirm that. So the few things that I could find, and it was very scant, and I did tons of searching, basically is that, as we've talked about all day long, we know exposure, especially with children at really young ages, is associated with so many poor outcomes on so many levels. It's affecting relationships with peers, with their families, affecting mental health, all these things we've already talked about. It's been well established. So that I found lots of articles around that, lots of research around that. There's also a lot of research around, again, children viewing pornography and then acting out what they're seeing, resulting in sexual violence, assault, harassment, especially if we're looking at the adolescent age range. So that's definitely been established as well in the literature. Next slide. There's also has been very recent literature that's been done. There's actually been a few studies this year that were published showing many kids are being exposed. We know it's really, really high. So I talked to a colleague a couple of weeks ago. He works in I live in Kansas City. He lives in the Midwest where I'm at. And he was saying that he was teaching a very rural high school. So rural high school, middle of America. And the school was like, we don't have a problem with porn. The kids do not look at porn here. Of course, our kids don't do that. So he said, okay, I want you to just see what they're looking at on their school issued devices for a month. Just see. So the school tracked, there are only 140 kids in this high school, so very, very small. And what they found was that in 1 month, there were over 13,000 hits to Pornhub from this rural school in mid-America. That means every student is going to Pornhub 3 times a day for a month on their school issued device. So we know a lot of kids are seeing a lot of porn. And again, that is bared out in research that we were able to find. We know most kids are seeing pornography through some type of device, right? So of course, kids really don't have access to printed materials anymore. It's all happening online for the most part. And then there's just a massive gap that exists where a lot of kids are seeing a lot of violent porn. Parents have no clue that this is going on. And we know absolutely there's a connection between problematic sexual behavior and early porn exposure. The younger a child is exposed to pornography, the more likely they're going to struggle with porn addiction for the rest of their life and all the fallout that comes with that. So that's what I could find. And then it was just a desert of basically nothing around everything else I was trying to find. So I really could not find, I found like a handful of articles kind of pointing us in the right direction. But essentially there is nothing, especially like for healthcare workers, for social workers saying, hey, this is how you routinely assess a client or a child or a patient for pornography exposure. Here's best practices. This is how to do it in a trauma-informed way. This is how to do it, as a forensic interviewer. Like that does not exist. I could not hardly find anything. So it's like, I could find a few articles that would touch on it, but then definitely nothing that was specific enough to say, here's the exact steps that need to be taken. Again, we're just so behind sort of on the professional world that we have to start to create these things because they don't exist. Something else that I couldn't find was how is this affecting victims? So again, we know with many, many kids who are sexually assaulted, porn is playing a role. I cannot tell you the amount of teenage girls I've taken care of that are saying, yes, this boy at school looked at porn, then he assaulted me in the bathroom. This boy's looking at porn on the bus, then he assaulted me, wherever. Like they're looking at porn, then a sexual assault is happening. We're not even asking the victims, how does that affect you? What's the long-term impact? Are you also looking at pornography to cope with this? Like there's been absolutely no research done around how it's impacting victims that have had porn be a part of their assault. And so I think that's another important thing that we need to look at. The other thing that I can say anecdotally, but also I just couldn't find in literature is almost no one in a medical setting are screening adolescent males for pornography-induced erectile dysfunction. So we know it's affecting adolescent boys. There's actually a study done it showed that a third of the adolescent boys that they interviewed were struggling with erectile dysfunction or some type of sexual dysfunction because of pornography. I have never heard a medical provider ask this question ever. And so I think that's something really important that we need to start breaking into, not just the medical setting, but kind of thinking when we're having conversations around pornography, is this something we're asking? So really we're lacking screening tools. We don't know what questions to ask, how to ask them. I think for a lot of professionals, it starts to feel really overwhelming, and then there's no guidance for what to do. Kind of just a lack of processes, protocols, collaboration, resources. I mean, there's just not a lot out there. So there's massive gaps when it comes to trying to tackle this through a professional lens. So here were a couple of the articles that I did find that were very helpful. I did this about 6 months ago, so it's possible there are new ones since then, but probably not a ton. So this first one by Gail Horner, she actually is in our collaborative group, which Mandy's going to talk about in just a little bit. So we're very lucky to have her on our team working on these materials. But she wrote a great article and she laid it out. She's a nurse practitioner, basically saying, yeah, kids and adolescents are seeing porn. Here's why and how this can be harmful to them. We need to do something to address it. So she absolutely is kind of on the cutting edge in terms of medical providers addressing this. And then there was another study that was or article that was published, kind of asking primary care doctors and nurse practitioners to enter into this and to assess kids routinely. So you're seeing a teenager for a physical or whatever it may be. Why not talk to them about pornography, which is an excellent idea. So I was very excited to see that as well. It didn't give a lot of specific guidance of how to do that. It was just more like, here's an idea that would be good to implement. A couple other articles that have been really helpful. And if any of you want any of these, I'm happy to send them to you. So this one was actually published in Australia, talking through again, hey, we're seeing pornography play a role in kids who are committing sexual assaults. Why are we not assessing for this? If you look at some of the tools used in like the juvenile justice system, they were created in like 2000. Okay, internet porn was not what it is today. And so we have not updated these types of tools. So it was addressing that and saying we need updated tools to see really how this is affecting kids with problematic sexual behaviors. This other article was done in Canada about the disclosures of kids with problematic sexual behaviors. And what they found in this study was that the kids who were struggling with problematic sexual behaviors were most likely to disclose that they were struggling to a social worker, it was usually if these social workers were approaching it in a trauma-informed, like non-shaming way, which is really interesting because it builds the case that professionals might be the safest person for this kid to disclose this information to. And then this last study was really interesting. And this basically, the researchers reached out to parents and said, hey, has your young kid, so under the age of 12, seen pornography? If so, how did you find out? And what was your reaction to that? And this study was very interesting. You can go to the next slide. Kind of the main takeaways from the study was out of the 279 parents that they surveyed, none of the parents found out that their young child had seen pornography because they asked them. That was never a conversation any of these parents had. It was either because they walked in and saw that their kid was looking at something, or maybe they looked through a child's history on their phone or their iPad or whatever it may be, or someone showed it to them and they found out, but it was not because parents had a conversation with their younger child about pornography, which absolutely shows the huge need for us to equip parents with that because they don't know how to have these conversations. Another key finding from the study was that so beyond kind of helping parents know how to respond in a way that is not judgmental, where they're able to, have a healthy conversation with their child, they also recommended it would be great for pediatricians to not only know how to talk to kids about this, but also their parents, because it's absolutely a medical provider within their wheelhouse to say, hey, parents, here's something your child has been exposed to. Here's how you have a conversation. And so they were recommending absolutely professionals need to get involved with this as well. So what do we need for people working on the front lines? So many things. Here's just some examples of things that we get asked on a daily basis. So how do I get my kids self-generated child sexual abuse material? So they're naked photos, videos that have been created. How do I get these off the internet? And there are some resources that exist, but it's happening all the time. I can't tell you the amount of parents that have called or that I've seen they're saying my 8, 9, 10-year-old has been inserting objects into their genitals and filming it and sending it to strangers that are asking for it online. Like, these things are very real and they're happening. And of course, for a lot of parents, you can imagine the shame and the probably just anxiety around even having to tell another person that this is going on. So we're seeing this all the time. We have other parents saying, hey, I found porn on my kid's phone. I know they're looking at it. I don't know what to do. We've taken their phone away and we give it back. They keep looking at pornography. How do we address that? Or there's times we've had patients that say, yeah, I look at porn all the time. I don't think it's a big deal. Like, so what do we do? How do we equip frontline professionals with, here's how you address these different situations? We want to give them the resources, the screening tools, the referrals to know, hey, if I run into this scenario, I know how to respond. Next slide. So same thing, like, we've had this scenario happen many times, unfortunately, where we have, you know, a 9 and 10-year-old who's looking at pornography and the parents are like, we don't care, not a big deal. Like, we saw porn when we were teenagers. We don't think that it's a big deal that our kid is looking at pornography. So again, how do we empower professionals to know, how do I address this? How do I have a conversation with parents to say, okay, let's talk about the brain. Let's talk about these different things. I think a real and honest challenge that happens a lot of times is, so we may be able to make the case that, okay, pornography is harmful to kids because of X, Y, and Z, and that's clear, but we're speaking to adults who are looking at pornography all of the time. And so sometimes you're going to hit that roadblock of there's that disconnect where they don't think it's a big deal because it's a behavior that they're engaging in themselves. And that can be challenging. So again, kind of knowing how to navigate those conversations. And again, sort of looking at societal trends, where what we're seeing is, for many, many boys, they believe sexual violence is normal, that it's something they should be doing. And for females, they don't want to seem vanilla, right? They don't want to have boring sex. They want to have porn sex because they think that's what boys want. So they're asking boys, I want you to strangle me. I want you to ejaculate on my face because that's what I think you want from me. And so again, creating this really confusing landscape for both of them, where no one is saying, what do I actually want? What do I actually enjoy? What can I communicate to you? It's, we both want to emulate porn, but is that actually what you want? We know from asking kids around screening questions around pornography, like I was talking about on the panel, we have just had crazy amounts of disclosures from kids of things that I don't think we ever would have known had we not asked those questions. You can go to the next slide. So for example, we took care of a 16-year-old patient last year. She had been sexually assaulted. And so I think historically, as healthcare workers, we would address the sexual assault, we wouldn't ask about anything else, we would send her on her way. But we know there's oftentimes a lot more going on beneath the surface. So we screened her for exploitation. We asked about pornography. We asked about trafficking. She told us that she had an abortion at the age of 11. Obviously, this is significant for multiple reasons. This girl had lots of risk factors to be exploited. She had been sexually assaulted multiple times in her life, obviously when she was 11, and at other times in her life. She had had over 60 consensual sex partners. And then she went on to tell us that she was on OnlyFans and she had been making lots of money through pornography on there, and her boyfriend, her quote unquote boyfriend, was helping her with it. So now we have a disclosure of trafficking. We are very concerned about multiple forms of exploitation on top of the sexual assault that was completely unrelated that had happened the night before. She was also in foster care and just had tons and tons of risk factors to continue to be exploited. And so we were able to step in as healthcare workers and then say, okay, what referrals do we need to make? What protective factors does this child need so she doesn't continue to be harmed? Next slide. All right, I'm passing it back over to Mandy.
Thanks so much, Heidi. So we're really trying to make this connection here when we when we collaborated with the CACs, and I have to give props to the CACs in Michigan for really taking us on at the state level and wanting this kind of collaboration. And really, Dr. Amelia Siders, Josh Bissell, Heidi, all of you for really approaching Culture Reframed and asking, these really important questions. So the question is, what do you need as child protection professionals in order to understand exposure to pornography so that you're better able to serve young people and their families? So we are, Heidi and I are both co-project leads on this project. We have leadership again from Dr. Gail Dines, Amelia Siders, Josh Bissell, who facilitate their respective small group specialties. So we have over 25 multidisciplinary specialists from the US and the UK. And from these are individuals from the CAC's MDT, multidisciplinary teams, forensic examiners, forensic interviewers, law enforcement, pediatrician, mental health, and telemental health therapists. Also the national and international SANE nurses, forensic nurse associations, and the allied healthcare and education research professions as well, like Jennifer Johnson that you heard from earlier. And what we are doing is collaborating to determine, as Heidi said, what this need is and actually get to business, roll up our sleeves, create the materials and resources that we need. So we started out with these project goals. We really want to, like Josh said earlier in the panel, not reinvent the wheel or continue, like Louise said, to work in these silos, but really collaborate and do what we already have. Just get those resources together. And by integrating the porn critical lens that Culture Reframed has into the work that CACs are doing, and really to assist these individuals in understanding the harms of hypersexualized images and pornography to children and young people, to know what to look for in terms of prevention and intervention, and to increase their confidence in talking about pornography with families, children, and their peers and allies. So our goal in this working group is to create free and easily accessible materials and resources so that we can have this interactive discussion or communication, talking effectively with kids about pornography and pornography use. As Heidi mentioned, screening and best practices are super important to us. That became a project goal, to have screening tools for problematic porn use and how to manage disclosures like the one that Heidi just mentioned. So what to do so that we can refer those young people and get them the assistance that they need. And then also work prevention, even though we know that's not a mandated dictate, we still want to be able to work on that prevention side as well. So here's just a few of the things that we're doing right now. This group just formed a few months ago, so we have been hard at work. We've developed these 3 smaller working groups who are made up of experts in their respective fields. So the clinical medical group, Heidi's leading the way with that. So they are developing currently those screening questions. They are taking a look at best practices, utilizing a kid-centered, trauma-informed approach and using the terms that kids use. So actually using what we know and how we're, anecdotally talking to kids, but also what little we have through research. And another best practice is to enter those conversations through devices, like Heidi said. So asking about what devices you're on, what tech do you use, what do you do when you're on Discord or a gaming platform, who do you play with and who do you interact with, so that we can really start to connect those dots. This group is also considering, like Josh had mentioned, using those platforms and forums for good. So creating TikTok videos that can directly discuss these instances. So Josh is leading the forensic and interviewing team that's made up of some criminal and legal professionals. They are hard at work drafting a call to action video from a law enforcement perspective. So having one of our very own law enforcement officials talk about why this is so important, why it's important to ask about pornography. developing those pre-screening questions for forensic interviews, and then having a question bank and scenarios. So those are all the resources that they're currently working on. And then finally, in the telemental health and education research, this is Dr. Sider's work. She's leading the team with this. She's come up with, their team has come up with the digital suitcase. So these are basic mid-level educational materials that we can use in telemental health. Also, creating curriculum and training based on Culture Reframed's porn critical lens for advocates and therapists, and really talking about those suggested questions to facilitate discussion both in practice and in research. So asking kids, have you seen anything that makes you uncomfortable, that's upset you? Has anyone shown you these types of images? Have you seen things that you don't understand? Do you find yourself wanting to go back to those? And then finally, do you have a trusted adult that you feel comfortable talking about these things, and maybe setting up that forum in which a child feels comfortable in talking about that? And of course, as we've seen today, the need for further research. So this group is really developing some ideas that hopefully we can pursue in further research.